the session today. So today I'm going to be discussing you can get valuable work experience and how to get the most out of the work experience you have already got. So my name's Shruti and I'm a fourth year medical student. So let's start. So first of all, a little bit about 6med. It's a company which was created by medical students for other medical students. And over the past 6 years, we've taught over 10,000 students, which has been really good. And some of the events we run are these surgery webinars that you guys are attending, which will happen every Sunday, 2 to 3 p.m. We do have a few more sessions coming up on things like UCAT, and going through each of the sections like verbal reasoning and decision making, that kind of stuff. So you can tune into that to help with your UCAT revision if you guys are in year 12 or if you're redoing the UCAT this year. We also offer UCAT and BMAT support. Now this can be one-to-one or it can be large group settings if you come to our courses, which happens every Saturday, which runs from 10 a.m. to 5:30 in the evening. And then we also offer interview preparation later on in the year. So October time all the way up until January of the following year, we offer large group interview courses as well as MMI courses. We also offer one-to-one tuition support in developing your interview skills if that's something that you're interested in later on. So a little bit about me. My name's Shruti and I'm one of the fourth year medical students and I'm studying at the University of Bristol. This year I intercalated in the Imperial College of London, and I studied medical sciences with endocrinology, so everything to do with hormones basically. And it's a 1 year which you take out of medicine to do research in something you're interested in. So that's what I've done for this year. I do really enjoy teaching, which is why I do sessions like this. And I've been involved in doing one-to-one tuition support, UCAT support, and personal statement support as well, because I really do like sharing my knowledge with other people. Currently, I'm interested in endocrinology as well as surgery, as I'm studying in medicine. Okay. So what are we actually going to cover today? So first of all, we're going to look at what medical work experience actually is and why it's important. And then we're going to look at the role of a doctor and how that comes into medical work experience. Then I'm going to talk about the different types of work experience you could get involved in. And then we can have a little debate on which work experiences are better than others, for example, or is there really a better work experience than another, or is it more about what you get out of what you've learned? And then I'm going to talk about what I did for my own work experience, so you get a little bit of an idea of what you could do and what you could arrange for yourselves as well. And then how to reflect on work experience, because it's all well and good doing the actual work experience, but the thing that you need to get out of it is how you're able to reflect on what you've learned and then be able to talk about that both in interviews and in your personal statement. So I'll teach you how to reflect properly. And then I'm going to end the session with a little bit of advice and top tips for how to arrange your work experience. After this session, after the advice bit, we will do a Q&A. So any questions you may have related to work experience or related to any part of the medical school application. So this can be based on, things like you're worried about the personal statement, or you're worried about how to arrange work experience, or things on the UCAT, or things on the interview. I'll be able to answer them at the end. If there are any really urgent questions, make sure to put them in the chat and I'll answer them as I go throughout the PowerPoint. Okay, before we start, just a little bit of housekeeping. Just make sure that you're muted during this session to avoid any disruptions while I'm going through the slides. And I try to aim to make this session really interactive rather than just talk at you and give you a lecture. So I have loads of questions coming up as well, and you guys can interact on the chat function. So type any comments or answer any questions in the chat box, and then I can see what you guys think in terms of each slide. And then please ask questions and I'll try my best to answer them as I go along or right at the end, as I mentioned before. Okay, so the first question then, on a scale of 1 to 4, how much do you know about work experience? So 1, no knowledge, 2, some knowledge, 3, lots of knowledge, but you want to find out more, and 4, you're confident in the different types of work experience. So you can just type in the numbers 1, 2, 3, or 4 in the chat box and let me know how you're feeling at the moment about work experience. Okay, I'll wait a few seconds for a couple more responses. Okay, most people are a 2/3. Anybody else quite confident, or anybody else feeling really like they don't know much about work experience at all? Okay, so most people thinking around a 2 or a 3. So you have some knowledge, or you know a lot about it, but you just want to find out more and see if there's any gaps that you want to address, which is fair enough. So hopefully this session will aim to do that and help you get to a 3 or a 4 by the end. Okay, so what are the aims then? So the main thing I want you guys to get out of this session is to understand the importance of work experience for getting into medical school. Why do you actually need to do it? Why do medical schools ask you for work experience? And for you to get an idea of the different types of work experiences that you can get involved in. So those are my 2 main aims. Second question then, if people could again use the chat box to type their answers. What is work experience? What do you think work experience is? And give some examples of some types of work experience. So if you could type your answers in the chat box. It could just be a few bullet points. You don't have to write full sentences or anything. I'll wait a few more seconds. Anyone have an answer? Okay, so Nucha, I hope I'm pronouncing your name right. You've said following doctors to visit patients. Yeah, so that's the main thing that you do. So that's one type of work experience. So what you're describing there is secondary care work experience in hospital. And can you think of anything else that you can do as work experience other than in a hospital or a GP setting? Anyone? Someone has said pharmacy. Yeah, so learning about drugs and how to sort of how that sort of works is also important. Somebody else has said care home. Yeah, so working in as a healthcare assistant or volunteering in a care home can give you insight into, how to use your communication skills, how to care for the elderly, things like that. So those are really good options. Work experience also doesn't have to be medical, so I'll come on to that in a little bit later. It can be, non-medical work experience, but you have those transferable skills which you can use in medicine as well. Okay, let's move on. So what is work experience then? So it's any period that's spent in the workplace to learn what that role entails, basically. And it should help you understand what the role of a doctor is, the day-to-day life of a doctor. And any people-focused work experience is useful for medicine. So what I mean by this is things like the suggestions you guys made. So following doctors to visit patients, working in GP, in a care home, things like that. All of that is very medical related, medical centered work experience. But any people-focused work experience is relevant for medicine. So what I mean by that is like if you're working with young children, or if you're working in volunteering in the community, if you're doing a part-time job where you're dealing with lots of customers, all of that is people-focused. So that will still be relevant for medicine because you're using the same skills, which are communication and empathy, in order to deal with people. And that's what medicine is. It's a people-focused job. As I mentioned, so work experience can be voluntary or it can be paid. So paid part-time work, if you have part-time work alongside your studies, can also be considered that because you learn certain skills which are useful for medicine there as well. And then what are the types of work experience you can get involved in then? So you can get involved in work experience where you're working with people in a care or a service role. So with people who are disabled, ill or elderly. And then if you're or directly observing healthcare, which is what some people mentioned. So things like working in secondary care to observe how doctors deal with patients, working in primary care to observe how GPs deal with patients. Oh, we've got one question. So someone has said, if you have a job, but it ticks some of the boxes, does that count because you get paid? Yeah, it should. So it depends on what type of job it is, obviously, because if it's like online tutoring, for instance, can be a good one because you're working with young people and you have to break down difficult concepts into smaller chunks for them to be able to understand. You do the same thing as a doctor, because really, really complex diseases, patients might not understand it if you're trying to describe it very scientifically. So being able to break that down into simpler terms, then yeah, that's really good as well. Referring to my previous question, say you work with young people. Yeah, so working with young people is fine as well, because you're using your communication skills, and you might be involved in things like safeguarding and things like that. So talking about that in your interview as well as in your personal statement can be useful. So I could use that as an example as well. I wouldn't use that as your main work experience example. I would also try and get other work experience like in GP or a care home or volunteering with disabled people or elderly, but it's still good to have this one as well. So hopefully that answered your question. Okay, next question, if everybody could type their answers in the chat. Why do you think work experience is important? Why do we actually do it? And why do medical schools request students to have work experience? Why do you think? I'll give you guys a few seconds to type your answers into the chat box. Okay, we've got a few responses coming in. So someone has said, allows you to gain a realistic insight of the career. Yeah, that's a really good point. Anybody else think any other reasons? Do you guys agree with that point? Do you disagree? Do you think there's anything else to add? What do you think? Okay, I'll move on then. So work experience is important because medicine's a career of life where you're committed to lifelong learning and you're caring for the sick and vulnerable as well. So realizing that it is a lifelong commitment is really important early on, right before you sign up to do this as a career in future. It also helps you, as someone said, give insight into what a doctor does, and it shows your commitment to medicine. If you've gone and done lots of work experience, it shows your enthusiasm and the fact that you really, really want to learn about what this career involves, and that you're passionate about this career. And even after you've seen what the day-to-day life of a doctor is, you still want to carry on doing this as a future job. It also helps you demonstrate that you have the qualities of a good doctor, because if you're observing how a consultant is speaking to a patient, for example, you'll be able to pick out the skills that they're using, but also use those skills in future to make other people feel reassured or things like that. So demonstrates that you have the good qualities of a doctor. And it also shows that you understand the realities and difficulties of this career. It's not always the day-to-day life of a doctor. It's not always going to be positive. Some days you might have a really, really sick patient that you can't do much for example, but understanding that it is difficult on some days, and sometimes you're just there for support and to talk to those patients rather than actually giving them treatment and seeing that they become better immediately. Shows that you're mature enough to understand that the realities are much, much different to what you see on TV, for example. Okay, next question. What do you guys think are the traits of a good doctor? So there are about 8 of them. If you guys can list any of the ones that you know off the top of your head, what do you think are the traits of a good doctor? So if a doctor came up to you, if you went up to a doctor, for example, to talk to them about something, a medical issue that you had, what would you want in your doctor to feel reassured and feel like you've been looked after? So type them in the chat again. I'll give you a few seconds to do that. Got one response. I'll wait for a few more responses. Okay, let's have a look. So someone has said good communication skills. I think communication skills are really, really important, especially not just with communication, it involves two parts. So it involves you being able to communicate the information that you have in an easy way, but also being able to understand what the patient or anybody else is trying to tell you. So communication to the patient as well as communication to your own team as well. Someone else has listed a few, so they've said communication, patience, and empathy. So patience and empathy are two really good ones as well. Okay, so let's have a look at the list. So what are the qualities of a good doctor? So first of all, trying and being approachable. So being approachable is obviously allows for patients to trust you and be able to confide in you. The second one, listening and communicating honestly. So being honest, open, and acting with integrity is one of the main rules of being a good doctor, which is according to the GMC guidelines. So this is a really important one. The next one is being non-judgmental. So that people and patients feel comfortable enough to confide in you about things that they might find embarrassing, for example. The fourth one, being passionate about learning, because obviously you're committing to lifelong learning as a doctor. So having a passion for learning is not just good for yourself as you become a doctor, but also good because you'll be involved in a lot of teaching the junior doctors below you. So being able to teach the younger people and also being able to teach your patients about the disease they have is really, really important. Number 5, being a good leader, but also being a good team worker. So I think they go hand in hand. And then last one, being empathetic as well. Someone's asked a question. So where can I find the values, the GMC values? I can't find them on their website. Compassion, empathy, etc. So that's a really good question. So if you type in on Google GMC guidance to a good doctor, you should get a document. It should be a PDF document on the GMC website, which you're able to download, and it's just a load of bullet points about, I don't know how, it's quite a short document which you should be able to get through, but it's not just useful for work experience, it's also useful when it comes to your interviews, because in different multiple mini interview stations they will test each of those qualities of a good doctor. So it's useful to have a read through that document. So GMC guidance to a good doctor is what the document is called, as far as I can remember. I will check whether that's the case, and then I can send you the link directly into the chat later. If someone could remind me at the end to do that, I'll be able to find it for you. Okay, next question. Have you completed any work experience yet? Yes or no? Just type your answers in the chat. Okay, so one of you has completed work experience. Okay, anybody else completed work experience? Okay, I'm going to take the silence as other people haven't. So let me go through the session then. So for the people who have said yes, they've completed work experience, what work experiences have you done? Just a few examples should be okay. Okay, so you've done work experience at pharmacy and a food bank, so that's quite a good variety of different work experiences to do, which is really good. And obviously you get different skills, don't you, from each of these. So that's really good. Let's have a look at what you can do. So I always split work experience into medical and non-medical work experience. Medical work experience, yes, it's really good to have that because then you have a direct insight into what doctors do, but it's also good to have non-medical work experience because it teaches you transferable skills, which you can then use in medicine as well. So let's have a look at the medical work experiences. So first of all, we've got General practice and secondary care, so hospital work experience. So those are probably the most obvious work experience you could get involved in. But as you guys might be aware, especially with COVID, and even before COVID, it was very, very difficult to get hospital work experience unless you knew someone, or unless you really constantly kept emailing them and asking about dates and times that they might be free. Your local GP might be a little bit easier to do healthcare observation in because they might have a little bit more room to teach students. Other types are working with others in a service role. So this could be working in a care home, for example, or volunteering at a care home, working in residential care homes. So there's something called Revitalize, which I'll come back to later on. And they run throughout the entire year. And you can do basically 1 to 2 weeks of work experience where you're looking after elderly people, but you also stay in accommodation nearby and you spend the whole day, the whole week with them basically. So I did it in my October half term, so you could time it so that you do it at some point like that. Hospices, for example, are another type of residential stuff that you can do. You could work in nurseries or special needs schools. These are obviously, nurseries are probably a bit harder to get. Special needs schools, maybe you can volunteer there. First aid volunteering, so things like St. John's Ambulance, which some people might have heard of, teaches you first aid skills, how to deal with people, how to perform CPR, how to deal with people who are choking or drowning, for example. So learning really important life skills there. And you can work in support services as well. So working on a mental health phone line, for example, can be really useful because it gives you insight into different groups of patients. Oh, someone's asked a question. What's the best way to find work experience? So I'll get onto that in a bit. The best thing to do is looking at your local GP, looking at your local hospital and trying and getting in contact. And obviously with the hospitals, you have to find the right email address for the HR group from that hospital, and then asking them if there's any doctors that you can shadow and saying that you're interested in medicine, so emailing them would be best. GPs, you can just ask them because it will be a local GP. You can go to reception and ask them, saying, you have a passion for medicine, you're considering this is a future career and you want to get a better insight, and then tell the dates that you're free and try and arrange some work experience, but make sure that they're very, very busy people. And obviously with COVID, they might say no. So it's a good idea to ask them very early enough. So if you want work experience in November, for example, you should really be arranging it now because they'll do it based on the rotas they have and how busy they are. So it's really important to organise it early enough. For non-direct observation of healthcare ones, so things like care homes, hospices and nurseries, it is just about sending them an email and asking them, saying that you're interested in this sort of work and you want to get a better insight about the care home side of things or the hospice side of things. And you want to do some volunteering, and you can do that volunteering every week on a Tuesday or a Wednesday after school, or whenever you're free, for example, or on a Saturday. And that's more of a long-term work experience / volunteering rather than a short-term 1 week like you would do in GP or secondary care, for example. So it's all about just planning it all early. That's what I'd say. But I'll get on to how to arrange your work experience later on. So other types of work experience, as I mentioned, which are non-medical, could be paid employment. So if you've worked in a customer service role, for example, working in Tesco, like in any sort of retail store, that's fine as well. Because again, you're learning communication skills, teamwork skills, how to deal with difficult customers, all of that, which can be transferred to medicine. Things like catering, again, because you're talking to lots of people, it's a lot of interaction and it's a people-focused job. That will be really, really useful as well, because again, you're developing your communication skills. Other types, other than paid employment, like I said, could be volunteering at a local church, temple or mosque. So it could be religious stuff as well, but you're still volunteering with the general public, or doing things like scouts and guides, which you might have done when you were younger. Okay, next question. So have you heard of any work experience opportunities during COVID-19? If you could type your answers in the chat, please. If you haven't heard of any, don't worry at all. I'll go through them in a bit and how to get involved with each of them. But if you have, just jot them down in the chat. Okay, I'll take silence as you guys haven't heard of much. So there's lots of virtual work experiences which were developed during the start of COVID, because obviously students who are interested in medicine weren't able to physically go in and observe doctors speaking to patients or observe what the day-to-day life of a doctor was because of the COVID-19 crisis. But because of that, they developed loads of online work experiences, which you guys might have heard of, and summer schools which sort of link you to work experiences and things like that. So the main one that most people might already know about is the BSMS free virtual work experience, where you're able to explore different types of specialties by doing these online courses in your own pace at your own time. And you can sign up to it. It's completely free, and you can do it whenever you want to, and you can finish it whenever you want to. So it's basically up to you in terms of timings. So it's the Brighton and Sussex Medical School who developed it. And it's really, really good to try and get an insight into the different types of doctors that you have. Similar to that, there's an app called Observe GP, again, to explore primary care, and then you can compare primary care as opposed to hospital medicine and see which one sort of interests you. And the final one is something called a Wanda VR patient journey to GP practice app, which gives you, again, an insight into primary care. There are more virtual work experiences which have been developed this year online, which you can always get involved in, but some of them are free, some of them are not. So it's really about what kind of work experience you want. So search them up online and see which ones you prefer. But the BSMS one is pretty good. Same with Observe GP. Okay, then the one that's most recent is obviously not a lot of you might be able to arrange this clinical shadowing. It obviously depends on where you live. If you're further up north, like in York and Scarborough, they do have lots of clinical teaching in the York and Scarborough teaching hospitals, where they do one-day placements for Year 12 students. And this is happening between the 25th of July to the 26th of August this year. And what you do is that they put you in different clinical areas where you're shadowing a member of staff. Now, this could be a doctor, a nurse, or a therapist, so a physiotherapist, occupational therapist, any basically medical member of the team for the day. So that will help you get a bit more insight. And if you're really interested in this, and if you think like this is something for you, then you can email them with the email here at the bottom. Let me just point to it. So the email here at the bottom, I'll come back to the slide if anyone wants to make notes on this. And the application deadline for this is 8th of July, so in 2 weeks' time. So if you are interested, make sure to email them early enough. And hopefully you'll be able to get a bit more insight if you live nearby those areas, so that you can get some insight into what medicine is like. Okay. So let's look at volunteering. So aside from medical work experience, you can do volunteering as well, which also counts as your work experience. Voluntary work is really, really good because it helps you gain lots of transferable skills in medicine. And it can help you work on your communication and teamwork skills as well, because you'll be dealing with lots of different people. Certain websites to consider to gain volunteering opportunities is Do It, which gives you lots of volunteering opportunities near you, and also Nextdoor, which does a similar thing. Okay, next question then. Are some work experiences better than others? Do you think yes, or do you think no to that? I'll just wait for a couple of seconds for people to answer, and then we can discuss that. Okay, so one person thinks yes. Does anyone disagree, or anyone agrees? No? Okay. So for the person who said yes, that some work experiences are better than others, why do you think that? If you could say a few things in the chat, maybe. Or if you're more comfortable unmuting and saying a few words, that's fine as well. So some might allow you to gain more skills than others. Yeah, I do see your point. Yeah, that especially the medical ones, you get direct insight, don't you, into medical, into what the medical specialty is like and what doctors have to go through day to day, basically. That's fair enough. I personally think that No, there is some work experiences aren't better than others. I think all of them try and teach you certain skills and transferable skills that will be essential for being a good doctor. The main reason I say this is because a lot of students worry that they don't have GP work experience or hospital work experience, and they really panic right before their medical school applications because they feel like they don't have enough compared to another applicant in terms of how much medical work experience they have. I just want to reassure you guys that medical school's admissions team don't just look at, they don't favour you if you've got medical work experience. They will also have a look to see if you've done any work experience and if you've tried to get medical work experience as well. That's always good. But if you haven't, as long as you're able to talk about the other skills that you've got from your other work experiences, that can still be used in your medical school admissions application. So don't worry if you don't have, GP or hospital experience, is what I'm trying to get across. As I said, it's how you use the experiences that you have in your medical application that's important. So someone said, is volunteering at a vaccination centre good work experience, even if you just greet people and lead them to doctors/health professionals? Yes, because I think you also, while you're volunteering at the vaccination centre, you might also have observed how the nurses or people, whoever's administering the vaccines, are speaking to these patients who are coming in for their vaccines. And that way you're observing communication skills, and you can still talk about things like that. And you're also developing your communication skills as you're greeting them and leading them to doctors. Some of those patients might be really worried, so they might have confessed something to you as you're taking them to the doctors or health professionals, and you might have used your empathy skills to try and reassure them that everything would be okay. So that experience is really good as well, so you can use that. Okay. The main thing to remember, it's not the type of work experience that you do, but what you gain from it and what you learn from it about yourself that matters the most. Okay. Next question. What can you do if you can't get any work experience? People can, in the chat, if you want to type something. Anybody have any ideas? Other than work experience, what else can you guys do which might still be useful? If not, don't worry about it. I'll have to go through everything that you could. Okay, I'll take the silence as people aren't too sure. So what are the alternatives to work experience? The first thing to do is not panic, as I mentioned before. Try the online work experiences that I've given you, the Brighton and Sussex Medical School one, or Observe GP, for example, and then try and arrange video calls with healthcare professionals to ask them questions. They might not be able to accommodate you to come in person and follow them and shadow them and see what they do day to day, but they might be able to spare like half an hour or an hour with an online Zoom meeting or an online Teams meeting to say, to speak to you about what their career is like. So you can prepare a set of questions and you can say, I'm interested in medicine, I want to speak to you about this, blah, 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 blah. Hopefully they'll reply back to you by email. And then you can try and arrange a video call so that they answer all your questions. And that, it's not the same as going and observing work experience, but it is still helpful because you still get some sort of an insight. Try and seek non-medical work experience, as I mentioned before, and also read about the profession to gain insight. So there's lots of online resources and interesting medical cases like the Bauer-Garber case, or the Charlie Gard case. So learning about that and then seeing what your opinions are on that and being able to speak about it in your personal statement will still show that you're trying your best to gain as much of an insight into medicine as possible. Okay, so what I did for my work experience is a little bit different. This was 4 years ago when I applied in 2018. So the first thing I did was I did 1 week of local GP work experience. This was at my GP, and the main sort of things I did there was clerical work. I didn't get to see many patients. So it was Monday to Friday. So Monday to Wednesday, what I mostly did was just sorting out the patient records and things like that. Thursday, there was a vaccination clinic for children. So I was able to observe the nurse giving out vaccinations to children and seeing how she reassures them before they have their vaccine. So they're not panicking about it as much. And then Friday was just a half day. So that was just looking, I was in the consultations with the GP. So I was able to observe how the GP communicates with patients and then see what are the most common conditions people come in with during at GP. So things like heart conditions and lung conditions, they're quite common. Asthma, really, really common conditions that people complain of. And then things like diabetes is something that GPs deal with a lot of the time with patients as well. So that's what I observed in my GP work experience. I did it in the year before I was applying, and I did it during half term. Same thing with hospital work experience. I did that during half term as well. Spent 1 week in one of the hospitals, and the place where I was placed in the ward, which was obstetrics and gynecology. So it was to do with pregnant women and newborn babies. So I saw a little bit of both, and I was sitting in different clinics to see how doctors deal with patients at different stages of their pregnancy. So that was really, really interesting. Then the third one I did was a revitalised residential care home volunteering. So as I mentioned before, Revitalize is a company where people who live in care homes or people who have disabilities or special needs in terms of learning disabilities, for instance, they come to stay at this residential care home where they're looked after by a group of people, healthcare workers, as well as students who want to volunteer. And they spend the week as sort of their own holiday. And what you do as the volunteer is sort of help them with their daily activities. So things like making them their breakfast, going out with them. So they have daily activities that they can do. So one of them is to go on like a short cruise, or one of them is to go just take them out shopping and things like that. So helping them with the things that they need help with, basically. And at the same time, building a bond with them by, speaking to them every day for that week and things like that. So that's what a volunteer does at Revitalize. And I think they have 3 centres. They have one at Southampton, which was the one I went to, but they also have 2 up north for other people who are interested in medicine there as well. Next thing I did was St John's Ambulance. So I worked as a first aid volunteer, and this I'd done for 2 years. So I'd been doing this since year 11, and it was just because I was interested in first aid and learning how to perform CPR, how to deal with victims who might be choking or drowning. So what to do in that scenario, basically, and just gaining those skills, which I thought became really, really useful when I was writing my personal statements. And then next thing I did was age concern volunteering. So again, along with the St John's Ambulance, the St John's Ambulance, I did it every Tuesday evenings after school. And then age concern volunteering, I did it every Saturday. And it was sort of working at the till, trying and help. It was more of a customer service thing, but it was a volunteering role, and trying and speaking to lots of people who come into the age concern charity shop and things like that. The last thing I did was looking at online articles on interesting medical cases and, trying to learn a little bit more so that I would be a bit more ready for my interviews. So the last one is more preparation for interviews than it was for my personal statement. But the remaining ones were all the different types of work experience I was able to arrange for myself. The one thing I'd say with the GP and the hospital work experience, it's a little bit more it's a little bit more difficult to arrange that. So I would say try and start emailing people that you want to go to that hospital and learn about it early enough so that you have a better chance of getting these experiences before you submit your medical school application. So just because you've done work experience, that's not the end of it. So you also need to reflect on your work experience. And the way to best do that is to prepare before, during, and after your work experience really well so you get the most out of it. So before your work experience, the first thing I'd start with is research various work experience opportunities, see what you can do, see what's relatively close to you and that you'd be able to commute to easily. And not have to, travel really far. Although Revitalize was a really good opportunity for me, it was really, really far for me to get to Southampton. So it was a little bit of a stretch for me, and it was during October half term. So I think try and make it easier for yourself so that it's easily commutable and you're able to get to it and you don't feel too tired on the way back. The next thing is try and contact individuals early to arrange work experience, as I said before, and be organised as organised as you can, because they do have really busy schedules. So the better you are at sort of getting back to emails and stuff like that, the more likely you are to get those hospital and GP work experiences. Now, during your work experience, the first thing to do when you're there is be present and observe the skills that are demonstrated by the doctors. Have a little notebook where you can write down certain things which you found really useful to learn, so that you can go away and research that later, and then you can talk about it in your personal statements. Because if you just observe and you don't make any notes, you might forget what you observed, and after that, when you're coming to writing your personal statements a few months later, you might struggle to think about what you did in your work experience. So it's just making your life easier by writing notes down on interesting things you observed. Demonstrate the skills of a good doctor, so you can also talk to patients, just say hello, and like just ask them a little bit about their condition, and you will learn a lot from the patients. Reflect on what you've learned about the role and about your self during the whole experience, and ask lots and lots of questions. A lot of students get really worried that they shouldn't be asking questions because it will be disturbing the doctor from doing their work. That's not the case at all. Doctors really like it when you ask lots of questions. So be enthusiastic. If you don't understand why something is done a certain way, ask about it. If a doctor's talking about a certain condition and you don't know what that is, ask them if in their free time, if they can spare a few minutes and teach you a little bit about what that condition is. And after that teaching, you can write some notes down, and then you can talk about it in your own personal statement. And you can say, this is what the doctor taught me. I found this condition really interesting, and add that in your personal statement. After your work experience, as I said, write a reflection diary. I'll teach you guys how to write a reflection diary in a few seconds, because there are a few steps that you can follow easily, which 6med have come up with, and use these experiences in your personal statement to personalize your experience and show that these are all the different things that you've done to understand what the role of a doctor is. And then practice talking about these work experiences for your interviews as well. Okay. So what are reflection diaries? Reflection diaries are just notes that you have from every day of work experience. So what I did was I had a little notebook and I just dated every day. And I just noted down sort of key experiences that I observed. I didn't, on some days there wasn't that much going on. So those days I didn't make much notes. But for some of the days I did learn a lot. So I wrote down lots of notes on it, which I was then able to use a few months later for my personal statement. So think about what you observed that day. So that's what I start with. And then write 2 to 3 sentences of what happened in a certain event. So for example, did you observe a doctor talking to a patient? What was done well in that case? And list 3 qualities of the doctor that were demonstrated well. So in this scenario, did they have really good communication skills? Were they able to empathize and reassure the patient? Did they have good body language, which then made the patient feel more comfortable to disclose certain information that they might not have done if the doctor wasn't friendly, for example? So try and list 3 qualities of a good doctor, and then reflect on why these qualities are essential to be a doctor, and reflect and think about whether you yourself have demonstrated these qualities in the past at some point, and then link this experience that you've observed to why you think you would be a good doctor as well. And when you write your reflection diaries in this way, you're basically helping yourself later on when it comes to the personal statement, because this reflection is what they expect to see in the personal statement. So writing sort of a mini paragraph like this, which follows this structure, basically means that when you come to write your personal statement, you're going to make your life so much easier. Okay, so to summarize, the main important advice I can give you guys is to keep the reflection diary, just because it really does help you in the future, especially when you're stressing out about actually applying to UCAS, writing your personal statement, and then writing the UCAT and the BMAT, and then focusing on your A-levels. Having done a reflection diary when you originally did work experience just makes your life a little bit easier. Work experience doesn't have to be healthcare related, as I've emphasized beforehand. And make sure that when you are doing work experience, ask lots of questions and be curious if you don't understand what's going on, or if you want to find out a little bit more about certain conditions or why things are done in a certain way, for example. So these are some useful resources that you can go to. So 6med have a guide to work experience and getting medical work experience, which you can have a read of. The medical school's curriculum, the MSc, have the Medical Schools Council, they have a link as well to what types of work experience that you can get involved in. And finally, the GMC also tells you what types of work experiences you can do and why the patient journey is really important, and specifically talks about GP stuff as well. So on a scale of 1 to 4, compared to the beginning of the session, how much do you guys think you know about work experience now? 1, no knowledge; 2, some knowledge; 3, lots of knowledge, but you still want to find out more; or 4, you feel really confident in the different types of work experience. If you could just type your answers in the chat, 1, 2, 3, or 4. The only reason I asked this question is also to see if you guys have understood everything in slides. And it's also a bit of feedback for me to see how my teaching is as well for these sessions. So let me know in the chat how you feel. Okay, perfect. Got a 1, 4. A few other people as well, if you want to say something. Perfect, that's really good to hear. I've got, so this is the last slide. I'm just going to leave my slide on this section. I know someone wanted me to type in get the GMC guide to a good doctor. So let me find that document. In the meantime, if anyone has any questions, please add that to the chat box and I'll answer them in a minute. So what I can do is actually show you so this is the document that I'm talking about, and I'll add the link for you guys in the chat. So for the person who asked me about where to find the good medical practice guidelines, this is basically what it is. So hopefully you guys can see my chat, my screen even. So it's basically a document, as you can see, if I scroll down, it's a 67-page document. It's very, very easy to get through because most of them are in bullet points like this. And it basically talks about, as a good doctor, what you should be doing, and then it takes you through everything. And it's free to read, so you can look at the contents, which is on the right-hand corner here. It teaches you about knowledge, skills, and performance, safety and quality, communication, partnership, and teamwork, how to do that, and maintaining trust. You don't have to sit and read all of it. You can just read, pick the bits that you're really interested in and read them. It generally gives you an idea of how to be a good doctor, basically, or what they expect of a good doctor according to the GMC guidelines. So let me go back to the other one. Right. So someone's asked, did you write about all your work experience in your personal statement? So revitalize, my GP practice, hospital placement, all of them, I saw a lot of different things. I had lots and lots of examples. I didn't use them all. I spoke in 2 or 3 sentences about each of them. 1 to 2 sentences even, because you only have 4,000 characters for your personal statements. You are limited in what you can say. But what I did was I saved that reflection diary to use for my interviews later on, so that I could talk about that in more depth. So I don't think you'll be able to talk about every single thing that you've done, but you need to pick out experiences that really stood out to you and summarize that in 1 to 2 sentences. So you need to be really clever with the amount of words and how you're discussing it in your personal statement. So hopefully that answered your question. I can't see the link, sorry. So it should be in the chat. Hopefully you're able to see it now. I can only see the PowerPoint. Okay. Right, someone said, where can we see the link? I can't find it. Okay. Are you able, is everyone able to see my screen? And are other people having problems with the link as well? Can someone say something in the chat? Can everyone see the screen, or can no one see it? What I'm sharing, the good medical practice. Okay. Let me reshare then. Okay. What about now, you guys? Can you see the screen? Perfect. Okay, so and now when I type in the link, can you guys see the link as well? I'll just type the link into the chat. Can't see the link. Okay, can other people see the link, or are other people having the same problem? Because if that's the case, then I can try and send the link to one of the admin people so that they can send it to you on the group chats. But anyway, for the moment, this is the website that you go on to look at, and basically it tells you about what a good doctor is, and it talks through all the bullet points of what the GMC expects of you as a professional, as a medical professional. 67-page document, as I mentioned before, and there's 4 different bits. So it talks about knowledge, skills and performance, safety and quality, which is probably a useful one to learn about even for your situational judgment section for the UCAT. Communication, partnership and teamwork is probably the most relevant one for work experience. And then maintaining trust, again, relevant for work experience. So hopefully that made sense to everyone. Can other people see the chat? I see the link as well. Can't see the link. Can you see the link? What about now? Can everyone see the link? Perfect. Okay. So that's the link that you can use. Okay, anyone else have any other questions at all? I'll stop sharing now. Feel free to ask questions about, it could be about work experience, but it could also be about things like UCAT or things like personal statement and things like that. Let me know if you have any questions. If not, that's the end of the session. So you guys can leave if you don't have any questions. But if you do, if you want to stay behind and ask anything, you can either ask the questions in the chat, or you can unmute yourselves and ask a question. I'm happy to answer them. We have about 7 minutes left of this session, so I'm happy to stay and answer any questions you guys may have. Oh, before you go as well, there is a feedback link that I need to send to everybody for you guys to fill out. No problem. Let me just get that first. Surgery. Let me just get that link up for you guys. In the meantime, if you have any questions, feel free to ask them in the chat. They don't just have to be about what I've covered. They can be about even what medical schools you are thinking of applying to. You can ask me about what I did in terms of my UCAS application. I'm happy to answer anything. So with the teaching, if you could just, using the link that I've just posted in the chat, if you guys could just leave a little review for Trustpilot on for 6med, that would be really, really helpful. Thank you. And I'll just stay on if anyone else wants to ask any other questions. Any thoughts regarding virtual volunteering? So virtual volunteering, I think, is just as good as in-person volunteering, because you're learning the same skills, but also you're learning it in your own time, so you're not rushed for time, for instance. The main thing with that is you might feel like you weren't able to shadow specific doctors and have in-person experiences. So to sort of help you with that, that's when you can email certain doctors that you think are really interesting. So heart doctors or lung doctors that you've looked up in your local hospital, and you can email them and say, can I speak to you for half an hour online or something like that if you have some spare time, so that you can answer some questions, because I'm considering a career in medicine. Did you do UCAT? If so, what score did you get and how do you get a good score? So I did do the UCAT. Score wise, I can't remember, but I was sort of an average. I think it was 2,630 or something like that. And then I got a band 2 in situational judgment. So getting a band 1 or a band 2 is really good. Band 3 and band 4 less so. So band 1 is the highest and band 4 is the lowest you can get. How do you get a good score? I think it's just more and more with practice, because it's an aptitude test. I did a UCAT course yesterday, and the main thing with it is it's the more practice you do, the better you get at it. And it's because it's under timed conditions. You need to be able to answer it under pressure. So the only way to do that is by doing lots and lots of questions in advance of your UCAT test. So hopefully that's helpful. Any other questions? Anyone else? 4 minutes left if you want to ask anything. If not, feel free to leave once you've filled out the review in the link. No problem at all. Glad you enjoyed it. Yeah, hopefully we're able to learn a lot more about the work experience webinar. Will we get the slides or the recording? I'm not sure about the slides. I think you should be able to access the recording once this recording is saved at the end of the day. I'll have to double check with the SixMed admin team to see how they'll send it to you. So I'll have to ask them first and let you know. But the slides themselves, I'm not sure if they normally send them out, but I can double check. What universities did I apply for? So I applied for, so obviously with medicine, you apply for 4 medical universities and 1 non-medical. So the 4 medical ones I applied for was Bristol, Cardiff, King's College London, and St George's London. And the 5th choice that I did was Queen Mary's, University of London, and I applied for chemistry there. So I got offers from both Bristol and Cardiff, and the interviews for them were very, very similar as well. They were both MMI format, about 7 to 9 stations, and had lots of, one of the stations was even doing like a series of maths problems. And then in Bristol, they gave us a picture and you had to sort of write your own little medical report and sign it off as if you were a doctor as one of the stations. So they do have a variety of multiple mini interview stations as well in each of them. And with interviews, each university varies, and the weighting that they place on different parts of your medical school application varies with each year and with each university as well. Ahmed, what made you want to be a doctor? I think the main thing was just I really, really enjoyed biology in the beginning. That was my main thing. In A levels, I really liked biology and chemistry, and then especially about things to do with the heart and like human body biology, basically. And then I decided to try and find some work experience in medicine. And from then on, I just really, really liked the variety, because you can go into so many different specialties. And I thought that was the career for me, because it mixes both learning about the disease as in theory, but then also putting that into practice with the patients. So that's the main reason why I wanted to be a doctor. Okay. So hopefully I was able to answer all your questions and you guys found this session useful. I'm going to log off now, but if no one else has any other questions, thank you guys for participating with all the questions, and hope you were able to get a bit more insight into everything. No problem, and have a good day. Have a good rest of the Sunday, everyone. Bye, guys.